Hi, my name is Caitlin Barba. I'm the practice administrator for Westminster Medical Clinic, as well as the executive director for Colorado Center for Primary Care Innovation. Today's webinar is on a new program at Westminster Medical Clinic. It's about 2 years old. It's a new private healthcare option for individuals and businesses, more or less trying to find a different way to access health and care and services in primary care. So we can talk more about what that looks like after setting the stage. Some of the challenges that businesses are facing today are to how to keep their employees safe, healthy, and well, in particular throughout COVID-19. Businesses are also struggling to think about how to keep their employees engaged and productive, thinking about absenteeism and presenteeism. In Colorado, the health insurance premiums continue to rise, and I'm going to show you a couple of statistics here shortly about what those premiums really are and how can employers continue to pay these amounts. The literature does show that employees are more productive and more engaged when their health and wellness is a priority in the workplace. In terms of the public, it is hard finding care if your insurance has been lost, and what are the options in addition to Medicaid? There was a really significant statistic that was somewhat discouraging back in 2017. A large organization called Robert Wood Johnson Foundation did a national survey and found that only half of patients in primary care believe they are receiving excellent care. Here in Colorado and nationally, it continues to be a challenge to find in office and care access for appointments today. Now, the average wait time for a new patient is 24 days. Also finding someone who cares and finding a provider that will listen to you, discuss your options, help you talk through what the decisions could be based on your own personal circumstances and who you are is really important. COVID-19 and healthcare costs have been a little bit tricky to project. I did some digging, and there was, here from Vox, a quote, "Given the ongoing economic crisis, a significant number of people could be unable to afford their premiums, meaning insurance companies are not bringing in the same amount of money to cover the claims," which also has further implications. So I was curious if the plan is from insurance companies and the insurance commissioners to increase premiums over the course of the upcoming months or years. And I found an article that said the questions being asked to determine what the premiums are is the pandemic over by next calendar year? Do insurers need to dip into their reserves for covering costs related to coronavirus, and how many elective surgeries have been postponed? With that said, COVID-19 and any other diagnosis or healthcare issue kind of relates to how premiums are set up. And I learned that it's actually illegal for an insurance company to project their premiums or to charge premiums to cover their losses for the year prior. So what they're thinking is nationally, 17% of insurers project a 5% increase in premiums for next calendar year. In Colorado, as mentioned before, we have seen an exorbitant increase in our health insurance premiums, and that means that our employer groups are paying more, with the average of 7.3% per insurance company. So you'll see here on the left-hand side from Colorado data, different insurance companies are increasing their premiums at different rates. And then the Milliman Medical Index on the right-hand side is a pie chart to reflect what the total healthcare costs are per person, as well as how much is the employer group paying, how much is the employee or staff member paying, and then how much is out of pocket, just cash from that person. So you'll see in the light orange, the employer group is paying a majority of the costs. of any total healthcare cost per person. That includes their health insurance premiums, whereas the employee is paying smaller, and then their total out of pocket with their health insurance premium still does not equal how much the employer group usually is paying for their healthcare costs in Colorado. This is back from 2009, so the numbers have likely changed. I haven't come across anything that, or been able to find anything in research that actually shows some of these numbers. But what this chart says is that by these diagnoses, depression, obesity, if someone's having arthritis or anxiety, that employer groups are spending dollars. And presenteeism is the green bar, and presenteeism is defined as someone who is present at work but isn't totally engaged due to their illness, due to any one of these diagnoses here. Absenteeism is the dollars spent by the employer group because the person is not present in the workplace. And then the medical healthcare costs and the drug costs that employers are covering in that pie chart, the percentage of what they might be paying. So depression, obesity, arthritis, pain, and anxiety are certainly some of the top costs in the employer groups back in 2009. Acknowledging that now identifying depression and anxiety in Colorado has been more and more prevalent in primary care. Some of these costs would certainly have changed, as well as the interventions and the services that are being offered to the public, to any patient walking through a primary care office door. So what is direct primary care? It's a monthly cash fee. It's a way to pay for health care to a primary care practice rather than going through insurance. So sometimes practices are paid this monthly fee in addition to billing an insurance company for their services. This is called a hybrid model. Sometimes this could be considered a membership model. Otherwise, if the monthly fee is paid, it is possible that that is an all-inclusive dollar amount for healthcare with that particular practice. I have a YouTube that I'm happy to share with those who are interested, just to learn more about what direct primary care is. A couple of years ago, the Direct Primary Care Coalition had published an article that insurance consumes more than 40 cents of each dollar spent. And so what they were trying to share is that if we could actually switch into a direct primary care model, that makes 40 cents available to an employer group to actually spend on the health and well-being of their staff. So at Westminster Medical Clinic, our belief is that all people should have access and the opportunity to health care, health, wellness, and safety at work too. People spend more time at work sometimes than at home, as well as spending time at home working. And so here at Westminster, what we're looking to do is to partner with employers and business groups, as well as support any individual who's looking to go through this program in conjunction with a health insurance premium or plan that we would recommend, or on its own a la carte for direct primary care at Westminster. You can visit our website, look at our biography of the different innovative projects that we've done if you're looking to learn more. So Westminster Clinic and other primary care offices are all not created equal. In fact, direct primary care is not created equal either. And at Westminster Medical, these are some of the features of the clinic and the services that we provide that may not or occasionally not be available in other primary care practices in Colorado. We do have same day and next day appointments always available. We also have in-office or telehealth options. We can and do visit patients' homes. We could even extend that to the workplace as needed. We also offer longer appointments than generally offered in the marketplace of other primary care practices. One of the best things about Westminster Medical Clinic is that we have a comprehensive team and different disciplines to support the needs of your employees or you as an individual. We have everything from a clinical pharmacist, behavioral health professionals, and mental health counseling and therapy. We have a personal health coach. We can offer on-site health education events as well as employee wellness activities. And we also have an on-site laboratory draw center. So any patient doesn't need to go to a different draw center station. The Westminster Medical Clinic Direct Primary Care brochure is available on our website. Let me just pull it up here for 1 second. So what's included in Westminster's Direct Primary Care? We do offer different packages. So we have the Primary Care Plus package as well as a Health and Wellness Peak package. We can offer customized packages. Basically, your employees will receive the care that we can identify together as an employer group and as a primary care practice. So we would look to do an employee-based assessment and come up with what package would meet your needs most, especially if you're looking at something that's customized. Otherwise, the Primary Care Plus package offers all treatment for illness and injury, chronic care, preventive care. We do offer discounted lab tests and supplements and vaccines for your employees, as well as we have different procedures and diagnostics that we can review in person if you're interested. Our packages start at $99 per individual. There is a family and child discount, so it would be $69 per child, 17 years and younger. Okay. And this is just a picture of our care team there at Westminster. We're missing Dr. Brian Petty in that picture. Our main goal is to really help you reduce your costs, but potentially also improve your care access for your employees. And we're hoping that that then turns around into your business needs and can help shift your business as you continue to grow. So let me move into these final slides here. As I mentioned, we are looking to customize anything that you're looking for. So let's talk. The best way to get in touch with us is to sit down and have a conversation to explore what this could look like for your business. We're not looking to gain any fees or put upfront costs as a barrier for your group or for you as just an individual person. So no changes to our costs until the future, if that makes sense. We're just trying to help here. So we're looking to create a strategy together with you to help you. And so thank you so much. We are going to be taking questions at future webinars. And so please prepare those. Please feel free to submit those to the registration for the events that are hosted monthly. And I really appreciate your time. Thanks so much.